Good evening. This is Gilbert Salinas, and this is part 2 of my windshield survey that I am performing on my hometown of Harlingen, Texas. Now, to complete the healthcare resources section, I did have to take an additional drive, and this drive took place on April 17th from the hours of 9:30 to about 11:45 a.m. The majority of my drive took place within 4 square miles in the south part of town, known as a med center by the locals. At the heart of the Med Center are Harlingen's 2 acute care hospitals, Valley Baptist Medical Center Harlingen and Harlingen Medical Center. Surrounding the hospitals are several clinics and doctor's offices. Clinics serving all age groups, including 1 VA clinic and 1 clinic offering dental and healthcare services to patients of all ages with payment dependent on income according to their sign out front. There were several primary care offices, but the majority of them were specialists. And to give you an idea of how outnumbered the primary care physicians were, here's an example of what I came across. I came across 3 different dermatologist offices, nephrology clinic with their dialysis center located right in back of the clinic, a pulmonology clinic that lists 4 different physicians practicing out of that office, 1 women's health clinic, 2 OB-GYN clinics, 1 offering family planning services, and then the biggest clinic that I saw was that of a heart clinic offering cardiology services. It was 2 stories high, and the sign out front listed 9 different cardiologists practicing inside that office and 7 mid-levels, including 5 physician's assistants and 2 nurse practitioners. Now, the largest primary clinic that I came across only offered 2 physicians and 2 mid-levels. I did come across 2 other clinics that had 2 doctors each, and I came across 2 other clinics that had 1 physician and 1 nurse practitioner inside the office. And also in the med center, there is 1 clinic that is run by a nurse practitioner. We do have 1 pediatric clinic in the med center and a 2nd pediatric clinic just 3 miles north. We also have a night clinic offering services to people of all ages and 1 urgent care emergency room in the med center. Harlingen does have a 2nd urgent care emergency room located in the western part of town. We have 5 nursing homes in Harlingen, all of which are located in the med center. And close by, there's also 2 outpatient physical therapy centers. At no point did I come across a mental health clinic or any alcohol or drug treatment centers. I am aware of 1 homeless shelter located in town. However, I am not familiar with the services that they offer. In the med center, we have 4 pharmacies, including 1 Walgreens, 1 CVS, and 2 locally owned pharmacies. Walgreens has 2 other locations in town for a total of 3, and CVS has 1 other location in town for a total of 2. And there are also 2 other locally owned pharmacies in town, all of which are located in the central part of Harlingen. I do believe the resources that Harlingen has to offer are appropriate, but definitely not sufficient, especially in regards to primary care and specialty care. And I do have a short example in regards to specialty care. In the 4th quarter of 2018, both of my young children did need to see a dermatologist and were referred by their pediatrician. However, none of the 3 dermatologists here in Harlingen were accepting new patients, and we had to drive 30 minutes into the next town to find a dermatologist that was taking new patients. The only suspicion that I had of possible pollutants was when I did drive by this canal-like body of water. There was a sign that said, "Do not litter. Water drains into the Arroyo Colorado." Next to this canal, there is some farmland, and I have to drive by this area every day. And throughout the week, I do see the local farmer and his crew with the machinery, sometimes spraying what is most likely herbicides and insecticides into the ground. And it is possible to have some runoff as the canal is not very high. Um, the neighborhoods around the Med Center are definitely middle to upper class. The houses are all very nice, well kept, cement foundation homes, um, perfect landscaping and yards that are maintained very well, screen windows. As you drive through the neighborhood, you're going to see newer model vehicles in the driveways and actually plenty of boats as well. There are also several small apartment complexes located throughout the Med Center. And once again, these apartment complexes are very well maintained, green grass, well manicured landscaping, paved parking, um, and also newer model vehicles inside the parking spaces as well. All the streets I came across were in great shape. Med Center is a heavy traffic area, but there are sidewalks throughout, plenty of stoplights, all in working condition. During these trips, I did not get stuck by a train at all. However, in recent memory, and all the times that I have been caught by the train, I have not noticed any of the guardrails or warning lights to be out of order at any of the train crossings. All the buildings, they do appear to have visible handicap parking and access. There are two parks close to the hospital with playgrounds and lots of land where there are several youth baseball teams practicing right now. Baseball and softball, because that's what's in season at the moment. The two parks connected to or close by to the hospital do connect to the hike and bike trail that runs along the Arroyo Colorado. And I did visualize many hikers and bikers taking advantage of those trails. And yes, there are public restrooms in these areas. We do have a Boys and Girls Club that is grossly underutilized. I do have to drive by the Boys and Girls Club several times per week between the hours of 4:30 and 7:30 p.m. and it's usually empty. One of the biggest reasons it's empty, I believe, is because it is located in the poor side of town. If you drive in the neighborhoods around the Boys and Girls Club, you're going to find older wood frame homes that are just absolutely falling apart. The paint's chipping away. Some have absolutely no grass or poor lawns, missing window screens, and overgrown trees throughout the neighborhood. At no point did I see children playing in the streets or alleys, but the parks in the evening do have heavy traffic, not only the youth teams practicing, but also parents and their young children either utilizing trails or the playground. There are several restaurants along the way, especially around the hospitals, that are mostly fast food chains. There are 3 taco stands here in Harlingen that sell their food just, right off the side of the street in a small parking lot. And one particular stand does offer outside dining. I did visualize trash receptacles, not only at all 3 taco stands, but also throughout the parks as well. The primary nuisance that we are running into this time of year is mosquitoes. During my ride-alongs, I was fortunate not to have this issue. However, I can tell you that during Easter weekend, as soon as the sun went down, my family and I were having to spray mosquito repellent on our bodies for protection. And during my observations, I saw a minimal amount of dogs that were on the streets without a leash. And I would have to say that they appeared to be loose dogs, not stray dogs, only because the ones that I did see were clean and well fed. This concludes part 2 of my windshield survey. Thank you.